Hey guys, welcome back for another episode of 5-Minute EMS Review, where we give you short and to the point videos on different EMS topics. Today, we are looking at a review of some cardiac terminology. Let's get started. So first off, we want to talk about the term stroke volume. Stroke volume is the amount of blood ejected from the left ventricle in milliliters in one heartbeat. So think about an engine with a piston and each stroke moving forward. This is what's going on in the heart with the left ventricle as it moves blood forward out of the heart. With each stroke, with each beat, it is moving a volume of blood out forward to the rest of the body. This volume in milliliters is what we call stroke volume. Now, building on that a little bit, we're going to move along to the term cardiac output. Cardiac output is the volume of blood leaving the heart every minute, measured in liters per minute. Now, the significance of stroke volume to cardiac output is very simple. Basically, we're going to take the stroke volume, or the amount being pushed out with each stroke, each beat, and we're going to multiply that by the heart rate in a given minute. And that is going to give us our volume in a minute's time. Stroke volume per beat times the number of beats in a minute gives us the cardiac output, or amount of blood in liters leaving the heart per minute. That's cardiac output. Now, moving on from this, we want to talk a little bit about systole and diastole. These are terms you're going to see used in relation to the heart as well as blood pressure. So we want to unpack these a little bit. Systole is the period of the cardiac cycle when the muscle cells are contracting. So when we actually have the heart beating or squeezing, that's systole. So logically, following from that, the systolic blood pressure is going to be the pressure in the blood vessels of the body during systole, or during contraction of the heart. So when you're talking about the systolic blood pressure, which is the number you write on top of your blood pressure, that is going to be the blood pressure in the vessels when the heart is beating. To the contrary, we have diastole, which is when the heart is resting. Diastole is the period of the cardiac cycle when the muscle cells are relaxed or resting. So again, it follows that the diastolic blood pressure is the pressure in the blood vessels of the body when the heart is at rest or relaxing. That is your diastolic pressure, which is the number you write on the bottom of your blood pressure. So these are terms that are going to be important to us as we talk about the heart. If you hear somebody speaking about systole or diastole, you can know which cycle of the heart they're talking about, and then you can also use that in terms of your blood pressure. Finally, I wanted to dig a little bit into the term ejection fraction. Ejection fraction is similar to stroke volume, except stroke volume is measuring only in the volume in milliliters, whereas the ejection fraction is the percentage of blood that is actually ejected from a ventricle. So if you think about it, a certain amount of blood fills up the ventricle beats and moves blood forward, but it's not actually going to squeeze out 100% of the blood on one beat. It's not 100% effective. So the percentage of blood that it does actually move out is the ejection fraction. So in a normal, healthy heart, we should expect our ventricles to move forward about 66%, or 2/3 of their content with each stroke or with each beat. That would be a normal ejection fraction. Now, this is going to be helpful to you when you start dealing with heart failure patients. People who have been diagnosed with heart failure have probably had testing done to tell them what their ejection fraction is. So if you're familiar with the definition of ejection fraction, as well as what a normal ejection fraction is, you will be able to pay attention and have an understanding of the efficiency of a patient's heart when they give you their ejection fraction. For example, say they tell you their ejection fraction is 30%. You know that that's going to be roughly about half of what you would normally expect in a patient's heart. So that will be something where you can use as you start dealing with your congestive heart failure patients. And that does it for our terminology for today. We wanted to look at stroke volume, we wanted to look at cardiac output, systole, diastole, and ejection fraction. We covered all of those. I hope it was helpful and unpacked a little bit of that for you. Stay tuned for more videos in our cardiology section. If you go to our YouTube channel, you can find different playlists about different topics. We are working through a cardiology one right now. So if you have other videos in cardiology that you are interested in, be sure to check that out. And if you missed the pathway of blood flow through the heart and the structure of the heart video, be sure to check that one out, as it lays a good foundation moving forward for further cardiology topics. We appreciate you tuning in. We hope you'll share the channel with other people that you think may find it interesting, and we'll see you next time.